We are back now talking vaccines with Dr. Deirdre Gifford, Commissioner of Connecticut's Department of Public Health, and Josh Geballe, Chief Operating Officer for the state. Dr. Gifford, I'd like to start with you in this segment. And what my curiosity is here is, how are we doing getting this across different populations? Is there still a gap between, by races or by economic factors? What are you seeing as the actual vaccine is administered?
Yes, really important question and priority for Governor Lamont and for the Department of Public Health. We are still seeing gaps in the percent of people vaccinated between Caucasians and people of color, and we want to see that gap close. And we're working very hard with our vaccinating partners to do that. As you know, we've identified 50 target zip codes, and we're out working in those zip codes with our provider partners. We are going to be doing door-to-door canvassing in partnership with our local health departments. We have launched a new set of vans that will be out doing smaller clinics in neighborhoods to reach people more easily. This week, the governor was present when we launched the first FEMA mobile vaccination unit, or MVU, in the country, which is in Bridgeport this week, doing about 400 doses a day in some of our highest risk communities. So we have a ways to go, but we are pulling out all the stops to close that equity gap.
Yeah, I saw on social media this week, Alex Putterman from The Current, who does a great job with data, put out a chart that just showed you are much more likely to have been vaccinated if you're white as opposed to being a person of color. What are you hearing, Dr. Gifford? Is it hesitancy? Is it access? What are the hurdles you're trying to get over as you try to change those numbers?
I think it's not any one explanation, but what we do know is that it's our obligation and responsibility to make sure that access in some of these hardest hit communities is as easy as it can be. And what we saw in the COVID pandemic is that not every community was impacted equally. People of color were more likely to get infected, and they were more likely to pass away from COVID. And that's because of longstanding inequities in health and in our healthcare delivery system. So the pandemic was a reflection of that, and we are committed with our vaccine program to do whatever we can to make sure that people have the access they need to get immunized from this infection.
Josh, what about other groups that are now newly eligible, especially young people? We got a question from a parent wondering if there was going to be any high school vaccination clinics in her area. We've also heard the same thing about college students. Of course, the clock is ticking before they scatter far and wide and head home for the semester. What are you doing to try to reach some of these folks who are now newly eligible?
Yeah, once we get through the first couple weeks here of this new phase where we're going to have a lot of people rushing in at the same time, we are making plans already mid to late April to do high school-based vaccination clinics. It's a little bit logistically challenging because only one of the 3 vaccines is approved to use for 16 and 17-year-olds. So when we're going into high schools, we need to be working with the limited supply of Pfizer that we have, and also with vaccinating partners who have the equipment to deal with that vaccine. It's a little bit harder to handle. And then also we're in discussions with our colleges and universities across the state, looking to do vaccine clinics for their students before they break for the summer. We know once summer vacation comes, people are going to scatter to all corners of the globe. We'd love to give everyone as easy an opportunity to get vaccinated, probably with the Johnson & Johnson vaccine in that case, where it's one shot. That's probably all the time we're going to have for them before they take off for the summer in mid-May. But we're working with our colleges to try to provide access there as well, recognizing that, as Dr. Gifford said earlier, these are some of the populations that are maybe taking a little bit more risk with regards to the public health protocols, seeing higher infection rates. We really want to drive the vaccination rates up in those populations.
And I know there's still studies being done on even younger people. We just heard word this week about teens and tweens might be eligible soon. Does that change your focus? Maybe that's a summer thing, Josh. When do we turn our focus to that population? Obviously, we need the health okay, but for your planning purposes, what are you looking at?
Well, we'll be ready to go as soon as we get the emergency use authorization from the federal government. When the vaccine manufacturers provide the data, to support that. Hopefully that comes, as you said, sometime this summer. One thing we've proven in Connecticut is that our vaccine providers can scale up their capacity very quickly. And so as soon as we get that EUA, as soon as we get the supply from the federal government, we'll be ready to keep working our way down to younger children, making that access available to them. And I know there's a lot of optimism that we can get a lot more school children vaccinated before we get to the school year next fall.
Dr. Gifford, we only have about 30 seconds left, but I want to leave it with this. When do you expect Connecticut will reach herd immunity?
Sooner than we thought, based on vaccine supply. So, I think we're looking at a real opportunity for that in the midsummer, and it's on all of us to make sure that happens. But I think that's a realistic possibility.
All right, Dr. Deirdre Gifford, the Commissioner of Public Health. Doctor, I just promoted you, Josh. You're just Josh Geballe. You're the COO for the state of Connecticut and our first two-time guest here on CT21. Thank you both for being with us. I'm sure we'll be talking to you again. This topic is going to continue. Coming up next here on CT21, what will be revealed when federal intelligence agencies release a much-anticipated report on unexplained sightings in the sky? We're talking UFOs next in our Sunday Spotlight.